Sue, thank you very much for that introduction. And I'm going to talk about vaccination in pregnancy, and currently there are 3 vaccines that are offered to pregnant women, which is influenza, pertussis vaccination against whooping cough, and more recently we've seen the introduction of COVID vaccination for pregnant women because of the pandemic. I just wanted to start by giving you some general resources and places to visit if you want to know a bit more about vaccination in pregnancy. And I think there are 3 key resources here. The top one is this thing that we call the Green Book. This is our sort of guidance manual, which is a national document for healthcare workers. And we've got a number of chapters in there that may be of interest to you. Chapter 6 talks about contraindications and special indications, and there's a section in there specifically on vaccination in pregnancy. And then we've got some disease-specific chapters which may be of use to you, one on COVID, one on influenza, and one on pertussis, and that's all available online. We've got a number of different training resources, including training resources on vaccination in pregnancy, on that website there, which is that UKHSA training resources website. And then finally, as Kirsten mentioned in the previous session, also the Oxford Vaccine Group, I think, is an excellent resource for all things to do with vaccination and immunisation. But they've got some really useful web pages for both health professionals and the public on vaccination in pregnancy. So those are the kind of general resources, I think, that are useful for IMS and vaccine pregnancy. There are also specific resources for each of the 3 vaccine programs that I'm going to talk about. And again, those will be listed at the end of each particular section. So in terms of influenza vaccination in pregnancy, we've been routinely offering women in this country an inactivated influenza vaccine since 2010. And the background here was that in 2009-10, we had what the press called the swine flu pandemic. You might remember the influenza H1N1. And it was recognized then that actually infection with that particular virus in pregnancy was leading to deaths and severe illnesses in some cases in pregnancy. So we know that the influenza in pregnancy increases certain risks. We've got some of them listed here. So we know it increases the risk of miscarriage during pregnancy. And in fact, as far back as the 1919 influenza pandemic, it was noted that actually the incidence of miscarriage went up during the first trimester during that pandemic. Maternal mortality and morbidity increases in late pregnancy if the woman is infected with the influenza virus, and that's thought to be because of T-cell suppression and because of increased oxygen demand, whilst at the same time some decrease in lung capacity because of the later stages of pregnancy. And we also know that there are more severe outcomes if the pregnant woman has other comorbidities such as obesity or diabetes. And children under the age of 6 months have the highest GP consultation rates for influenza and influenza-like illness. Vaccine safety, I think, is a really, really important feature of any vaccination program, and I think it's a key feature for vaccination in pregnancy. I think there are increased sensitivities around offering vaccines in pregnancy because the women and the healthcare workers offering them want to know what the evidence is for their safety and not just for their efficacy. This is a study that was actually published in the American Journal of Obstetrics and Gynecology as far back as 2009. And they looked at a number of different studies and concluded that no study to date has demonstrated any increased risk of maternal complications or untoward fetal outcomes associated with inactivated influenza vaccine. So we know that the influenza vaccines, or the inactivated ones, are safe to give at any trimester of pregnancy. There is a live influenza vaccine, which is offered to children from the age of 2 years up to 17 years. Because it's live, that would be contraindicated in pregnancy. So the vaccines that we offer in pregnancy are inactivated. Are they effective? What are the effects of giving these vaccines to pregnant women? Well, we know it reduces the risk of prematurity and low gestational weight. It provides passive immunity to the newborn child through transplacental transfer of antibodies in the first few months of life. There's a significant reduction of fever, respiratory illness from confirmed influenza in babies who are born to mums who were vaccinated against flu in pregnancy. It also reduces the risk of prematurity as well. So generally, what we know thus far about inactivated flu vaccines in pregnancy is that they have a good safety profile and they are effective at protecting the fetus, the mother, and the newborn baby. In terms of uptake, we're not doing terribly well. So we've got some data here from the seasonal flu program for the last 5 years. This year, it's about 33% at the moment. This is still provisional data compared to 2018-19, when it was as high as 45%. I think there are some difficulties in actually gathering this data because I think measuring vaccine uptake in pregnant women is difficult because the denominator is always shifting. But we've clearly got a way to go to try and improve access to the vaccine and try and improve uptake to it as well. In terms of where women can access a flu vaccine if they are pregnant, they can access it from their general practice. They might be able to access it from community pharmacy. A lot of pharmacies are offering flu vaccines to 18 plus. If they are employed as a healthcare worker, they can probably get it from their occupational health service, and they may be able to get it from people like yourselves. Some maternity service providers are commissioned to provide flu vaccines in pregnancy. And I think that's quite a key one for me because we know that midwives are the trusted voice for pregnant women. And if they're going to an antenatal clinic, then it would be good if we could tie up the vaccination program at the same clinic visit as well. Like I said earlier, they're all inactivated vaccines that we offer to pregnant women. And we have a preference for this thing called either QIVC or QIVR. This means quadrivalent inactivated flu vaccine, which is either a cell-based or a recombinant-based vaccine. And if you haven't got either of those, then you can use the older style egg-based vaccine. So there are 3 different choices of vaccine to offer pregnant women. Those are some of the resources. I'm not going to go through them all because we've got quite a lot of other slides to go through, but I think these slides are being made available to you, so you can have a look at those web links later. Whooping cough, or otherwise known as pertussis. This is an acute bacterial infection caused by the bacteria Bordetella pertussis. It's highly infectious. I think this and measles and chickenpox are some of the most infectious microorganisms that we know of, and their reproductive rates are much, much higher than things like COVID or flu. So they really are very, very infectious indeed. Whooping cough spreads from person to person through droplets, and it's usually infants and young children who are the most severely affected because they have an immature immune system. And about 90% of children who have a whooping cough infection will require hospitalization. And there are some quite serious complications from whooping cough, things like pneumonia, temporary pauses in breathing, weight loss because of excess vomiting, brain damage, seizures, encephalitis, and even death. And prior to 2012, the death rate in the UK from whooping cough was quite low. We sometimes sort of 5 to 8 babies per year might die of whooping cough. In 2012, there was nationally and internationally quite a big increase in whooping cough incidence, and we saw 14 deaths in England from whooping cough infection. We do vaccinate babies against whooping cough, and you can see there those big blue down arrows are where we offer pertussis-containing vaccines to babies, and we offer them routinely at 8, 12, and 16 weeks of age. But then the bars going up, in particular those grey bars, are displaying when cases of whooping cough were arising. And you can see that actually most of these cases of whooping cough in 2011, 2012 were occurring before we start vaccinating babies at the age of 8 weeks. So the routine childhood immunisation programme wasn't protecting and couldn't protect these very young babies, less than 8 weeks of age, from acquiring and potentially even dying from whooping cough. And that's why in 2012 a maternal whooping cough vaccination programme was introduced, and this is this graph here is showing deaths from pertussis due to whooping cough, and you can see there in 2012 that there was quite a significant increase. That's the year that we introduced the whooping cough vaccine in pregnancy, and you can see that thereafter the death rate from whooping cough has dropped, which was reassuring. The last couple of years we haven't seen any deaths from whooping cough. We suspect this might be a COVID lockdown effect. We've seen generally a decrease of many different types of infectious diseases. They haven't gone away. They will make a very unwelcome return at some stage, which is why vaccination remains important. But the vaccines given to pregnant women work by boosting the pregnant woman's antibodies. They then transfer transplacentally to the fetus, so that when baby is born, it's born with passive immunity from its mother. And that's a really, really important concept, because we want that passive immunity to protect this baby until we can start to provide active immunisation through the routine childhood immunisation programme from 8 weeks of age. So the studies that UKHSA have done have shown approximately 90% protection against disease and about 97% protection against deaths from whooping cough in the first 2 months of life. So this has been quite a successful programme. There have been a number of different studies looking at the safety of these vaccines in pregnancy, and 15 different studies, mostly conducted in Europe and North America, have collectively looked at about 150,000 pregnancies, and obviously different vaccines have been used in different studies, but none of them have shown any serious effects in either the pregnant woman or the newborn baby. So the risks, or we certainly feel rather like the flu vaccines, that the risks, the benefits far outweigh the risks when it comes to maternal vaccination against whooping cough. In terms of vaccine uptake, I realised as I was reviewing these slides on the train coming down, I've kind of slightly mislabeled it. So you can see that where I've written pertussis vaccine uptake in pregnancy, the key just underneath that is wrong. I cut and pasted the wrong bit. But anyway, ignore that. The squiggly lines that are going kind of from left to right there are the bits that we need to look at. And this is uptake of pertussis-containing vaccines in pregnancy over about the last sort of 4 or 5 years or so. And you can see there that there was some seasonal variation. We would see a dip during the summer, and generally it would go up during the autumn and winter. And we think that's probably because there was co-administration of pertussis vaccines with flu vaccines, and that kind of sort of brought it up a wee bit, but the highest we've had, I think, is about 75% uptake. The line that is near the bottom and kind of stops in June, that's last year, that's 2022, and you can see that there's been a decline in uptake, unfortunately. We're not entirely sure why that is. We think it's probably a number of different factors. It could be are women coming forward, particularly during lockdown periods, for their antenatal clinics, and therefore are they being signposted and counselled about the benefits of pertussis vaccine in pregnancy? It might be that they are concerned about COVID, either catching it, or maybe concerned about the COVID vaccine in pregnancy. So that there is some decline which we are working to try and reverse. So I just can't get my clicker to work. Here we go. There's some more specific pertussis resources there, which you can have a look at when the slides are circulated. Just doing a quick time check. Perfect, about halfway through. So that was a brief kind of canter through flu vaccine and pertussis vaccines in pregnancy. I'm going to talk a bit more about COVID vaccines in pregnancy because I think this is a bit more current, and I've got more slides on this than I have on the other two topic areas. So COVID vaccination in pregnancy, what do we know thus far? Well, we know now that infection with the SARS-CoV-2 virus or COVID during pregnancy can increase a number of different risks for the pregnant woman and for the unborn child that she is carrying. So pregnant and recently pregnant women who are infected with COVID are more likely to be admitted to the intensive care unit, more likely to need ventilation, and more likely to need this thing called ECMO, this extracorporeal membrane oxygenation, compared to non-pregnant women who are infected with COVID. A number of UK studies have looked at the background rates of stillbirths in infected women, and that shows a higher incidence in women who are pregnant and infected with COVID than non-infected. And we also know that the COVID infection increases preterm birth in women who are symptomatic with COVID infection, and women are more likely to have severe COVID infection if they've got other risk factors such as being overweight, from a black or minority ethnic group, diabetes, hypertension, asthma, greater than 35 years of age. So this is not, to me, this is not unlike flu in terms of the risk factors, and in particular later pregnancy as well, for the reasons I gave around flu. So infection in late pregnancy is associated with poorer outcomes. So in December 2021, following recognition that pregnancy is a risk factor for severe COVID and all the poor outcomes associated with it that we've just spoken about, particularly during the Delta COVID wave, that pregnancy was added to the risk groups who were eligible for a COVID vaccine. The vaccines are inactivated, and like flu, they can be offered at any stage of pregnancy. Currently, the Pfizer-BioNTech and Moderna vaccines are preferred for eligible pregnant women, and for those who are under the age of 18, then there is a preference for the Pfizer-BioNTech because we've got more experience of using that vaccine in pregnancy. If the mRNA vaccines, which are the two I've just mentioned, aren't suitable, then there is this thing called Novavax, which I think is still currently available, that can be used for women who are absolutely contraindicated to receive an mRNA vaccine. In terms of the benefits of the vaccine in pregnancy, there's increasing evidence of how it can protect maternal and fetal health. So a systematic review and meta-analysis of 81,000 women vaccinated in pregnancy compared to 255,000 who were unvaccinated found that it lowered the risk of NICU admission for the baby, it lowered the risk of intrauterine fetal death, and it lowered the risk of maternal SARS-CoV-2 infection. This was a study, I don't know how well you can see that, but this was a study that was published in the BMJ towards the end of last year. And those graphs at the bottom, those bar graphs at the bottom, look at outcomes compared to or associated with the number of doses of COVID vaccine that the pregnant woman has had. And there appears to be a strong association between the more vaccines that the pregnant woman has had, the better the outcomes. She is less likely to end up on ICU and less likely to have severe COVID infection whilst pregnant. In terms of safety, I think this is very, very important, and I've got about 3 slides on this because of its importance to healthcare workers and to pregnant women. So this study that was published in October last year found no association with preterm birth in vaccinated women or for being small for gestational age or for low APGAR score, and also that the COVID vaccination was not associated with any increased risk of postpartum hemorrhage, cesarean section, or chorioamnionitis, if I've pronounced that correctly, and I'm sure you'll correct me if I haven't. Where are we? Next slide. And then 2 studies from the USA and from Norway compared miscarriage rates between vaccinated and unvaccinated women who were pregnant over the same periods. And the vaccines they were looking at are the 2 we mentioned earlier, which is both the 2 mRNA vaccines. These are Pfizer and Moderna, which we're still using. And they found the occurrence of miscarriage was equally likely amongst unvaccinated women at the same stage of pregnancy as compared to vaccinated women. So we don't think the vaccines themselves would cause any sort of baby loss in the early stages of pregnancy. And then the final the final vaccine safety slide. This is a study from Israel that was looking at outcomes from more than 2,000 women who were vaccinated with the Pfizer-BioNTech vaccine in their first trimester, compared to 3,500 who became pregnant around the same time. And again, it's a very similar message, is that there were no differences found between the unvaccinated group and the vaccinated groups for preterm births, neonatal hospitalization, mortality, and birth defects. So the vaccines appear to be safe in pregnancy, but also providing a protective effect to the mother and to the baby. On the train coming down from Yorkshire this morning, I follow someone on Twitter called Vicky Mail. Vicky is a immunologist at Imperial College, and the bit of immunology that she specialises in is reproductive immunology. And she's fabulous, and I need to get in touch with her to see if we can do some work together, because she's pulled together all the studies that have looked at COVID vaccination safety in pregnancy, and found that there are about 33 of them, and all of them are coming up with the same message, is that actually these vaccines appear to be safe to give to pregnant women. And I think that's quite a reassuring message, and I need to get in touch with Vicky to see if we can actually kind of summarise this perhaps in a paper or an infographic, and get that out to pregnant women and the healthcare workers that look after them. Just wanted to spend a little bit of time looking at COVID vaccine uptake. Again, it's a difficult program to measure uptake, because the denominator shifts all the time, and because we've offered primary doses of, two doses of primary vaccines, and then we've offered boosters as well. So I've just looked at April to June last year. This was the most in-depth, up-to-date data that I could get hold of. And I think what this graph shows is quite a big variation by age of pregnant woman. So if we look at 2 doses or more by the time of delivery, for those women who are pregnant and under 20 years of age, only 25% of those women had 2 doses or more. But when you compare that to 40 and above, actually 76% of those women have had 2 doses of vaccine prior to delivery. So clearly an age differential. The younger the pregnant individual, the pregnant woman, the less likely it appears that they are going to accept a COVID vaccine. But also, when I was having a rummage around this data, and the link is in the bottom there of that page, there's also quite a big discrepancy, and women who are living in deprived areas, or women who are from black and ethnic minority groups, are again less likely to have been vaccinated. So we have got some inequalities and some discrepancies in the programme, and I think that's going to be food for thought for all of us really going forward, as to how we try and make this offer of vaccination, and maybe the acceptance of vaccination, a bit more equitable. Finally, some COVID vaccine resources. If you visited our stand out in the hall, you'll have noticed that most of our printed material is around non-COVID vaccination programs. I think the COVID vaccination program is changing so rapidly that we've sort of kept a lot of our stuff online, although we have got some printed and indeed some translations as well to try and support these the COVID vaccination program. So we've got that top bullet point there is kind of our overall collection of all our materials related to COVID. We've got leaflets and posters as well, and I think the other thing here, again, and this is the safety message, MHRA are the medicines regulator. They collect all the data around any side effects of vaccines that have been reported. And in fact, their summary, I think, for us as health professionals is very, very important to read, because I think that's quite reassuring, and it's quite open and honest about what all the side effects of all the COVID vaccines have been. But also, they've got some stuff in there specifically related to the safety of these vaccines in pregnancy and in breastfeeding mothers as well.